8 medications that scientific studies have associated with an increased risk of dementia. And no, memory loss is not an inevitable consequence of aging. Recent research shows that we can keep our brains healthy much longer than we previously thought, as long as we know how to take care of them properly. So, why can seemingly harmless medications cause such severe damage? And how can we protect our brains while treating other health conditions? These are crucial questions that we will answer throughout this video. It's important to emphasize that we are not here to demonize modern medicine. Many of these medications are essential for treating serious conditions and improving the quality of life for millions of people. However, it is essential that we are aware of the potential risks and know how to minimize them. The silent villains: omeprazole and anticholinergics. Let's start our list with 2 medications that seem harmless but can have devastating effects in the long run: omeprazole and anticholinergic drugs. First, let's talk about omeprazole. This medication is one of the most popular for treating heartburn, reflux, and gastric ulcers. It belongs to a class called proton pump inhibitors, PPIs. It seems harmless, right? Well, not so much. Recent studies have revealed a concerning connection between prolonged use of omeprazole and an increased risk of dementia. A study involving about 6,000 people showed that 10% of the participants who took omeprazole for more than 3 years experienced memory loss. Another study found that 33% of patients who used the medication for more than 4.5 years reported cognitive disturbances. But how does omeprazole affect the brain? It is believed that it may interfere with the absorption of vitamin B12, crucial for neurological health. Additionally, omeprazole can alter gut microbiota, which in turn may negatively impact brain function. It is important to note that we are not suggesting you stop taking omeprazole immediately. If you use it regularly, talk to your doctor about alternatives or the possibility of reducing the dose. In many cases, dietary and lifestyle changes can help control gastric problems without the need for continuous medication. Now, let's talk about anticholinergics. This is a broad class of drugs used to treat various conditions, from allergies to depression and urinary incontinence. The problem is that they block the action of acetylcholine, a neurotransmitter crucial for memory and learning. Studies show that prolonged use of anticholinergics is associated with a significant increase in the risk of dementia. A study by the University of Washington, which followed more than 3,500 elderly people for 10 years, found that those who regularly used anticholinergics had a 54% higher risk of developing dementia. Some common examples of anticholinergic drugs include first-generation antihistamines, like diphenhydramine, certain antidepressants, like amitriptyline, and medications for urinary incontinence, like oxybutynin. The indiscriminate use of these drugs, especially among the elderly, is concerning due to their potential to contribute to cognitive decline. If you are taking any anticholinergic medication, do not stop abruptly. Talk to your doctor about safer alternatives or the possibility of reducing the dose. It is crucial that patients and doctors carefully consider the risks and benefits of anticholinergics, seeking alternatives when possible, and limiting use to the minimum necessary doses and durations. Remember, the key here is prolonged use. Taking an antihistamine occasionally to relieve allergy symptoms is unlikely to cause long-term problems. But continuous use, especially in high doses, is what really concerns researchers. The hidden dangers: corticosteroids and benzodiazepines. Continuing our list, let's now talk about 2 types of medications that, while effective in treating various conditions, can have serious side effects on the brain: corticosteroids and benzodiazepines. Let's start with corticosteroids. These drugs are widely used to treat a variety of conditions, from asthma and allergies to autoimmune and inflammatory diseases. They are extremely effective in reducing inflammation and suppressing exaggerated immune responses. However, the prolonged use of corticosteroids, especially when administered orally, is associated with several serious adverse effects, including the deterioration of mental and cognitive health. Studies have shown that corticosteroids can cause structural changes in the brain, leading to problems such as disorientation, confusion, depression, and anxiety. An epidemiological study in the United Kingdom, which analyzed data from more than 500,000 people, revealed that those who used corticosteroids for asthma for long periods had a significantly higher risk of developing dementia and other mental health disorders. Glucocorticoids such as prednisone and dexamethasone are particularly concerning when used long-term. They can interfere with brain function, possibly due to changes in cortisol levels, a stress hormone that, in excess, can damage neurons in the hippocampus, the brain region responsible for memory. If you are using corticosteroids, especially for long periods, it is crucial that the use is carefully monitored by healthcare professionals. Never stop taking corticosteroids abruptly, as this can be dangerous. Instead, talk to your doctor about the possibility of gradually reducing the dose or exploring alternative treatments. Now, let's talk about benzodiazepines. These drugs are widely prescribed to treat anxiety and insomnia. Known for their calming and relaxing effects, drugs like alprazolam, diazepam, and lorazepam are effective in quickly relieving anxiety symptoms. However, prolonged use can have serious consequences for brain health. Studies have demonstrated a clear association between the prolonged use of benzodiazepines and memory loss. Research suggests that these medications can double the risk of developing Alzheimer's, possibly due to permanent brain damage. A study indicated that more than 40% of benzodiazepine users experienced a variety of neurological symptoms, including difficulty concentrating, lack of energy, nervousness, and increased sensitivity to sensory stimuli. In addition to memory loss, prolonged use of benzodiazepines is associated with a range of other adverse effects. These include sleep problems, anxiety, myalgia, and muscle weakness. Physical and emotional dependence is also a significant risk, making it challenging for many patients to stop using these medications. The relationship between benzodiazepines and Alzheimer's is particularly concerning. Although the exact mechanism is not fully understood, it is believed that these drugs may interfere with the normal function of neurotransmitters, leading to structural and functional changes in the brain. Additionally, prolonged use can negatively affect the sleep cycle, crucial for memory consolidation. If you are taking benzodiazepines, it is essential that their use is carefully monitored and limited. Doctors should consider non-pharmacological alternatives to treat anxiety and insomnia, such as cognitive behavioral therapy, relaxation techniques, and lifestyle adjustments. When benzodiazepine use is necessary, it should be for short periods and at the lowest effective doses possible. Remember, never stop taking benzodiazepines abruptly, as this can cause severe withdrawal symptoms. Always consult your doctor before making any